So, guys, 2024. Let's get this thing going. Sweet. All right, good evening, everyone. It's Dr. Joaquin Acosta, your guide and host for today's Know Your Pharmacist live stream, and the CEO of Pharmtrue as we embark on this insightful journey together on January 2nd, 2024. I'm thrilled to bring you a blend of the latest healthcare insights, technological marvels, and compassionate community stories. Tonight, we delve into a topic that touches the lives of millions, the revolutionary move towards more affordable insulin in America. This is a pivotal moment in healthcare, making a significant shift towards more equitable access to essential medications. We'll explore how this change not only impacts healthcare economics, but also the everyday lives of individuals and families. But that's not all. In our Tech Talk segment, we'll unveil the innovative efforts of Harvard's Technology and Global Health Initiative. Here, the brightest minds are working to bridge the gap between health and technology, fostering a new generation of leaders who will shape the future of global health equity. In our Enlightenment Hour, we're embracing the start of the year with a focus on dry January. It's more than just a trend, perhaps. It's a conscious decision to rejuvenate and recalibrate our bodies and minds. We'll delve into how this choice can lead to improved health and well being, and what neuroscience tells us about the benefits of such mindful decisions. For our Herbal Wellness Corner, we turn our attention to an important health alert. Guys, we are talking about cannabis users who are now shown to be less reliant on traditional sleep aids. Guys, we're looking at literally a study coming out of Washington State, over 1,255 cannabis users, over 80% of the users surveyed that they are no longer using over-the-counter sleep medications or prescription sleep medications such as melatonin or even benzodiazepines, right? So looking at all that, how awesome is that? Community Spotlight, guys, shining on Chris Kearns in the Wild West Shootout over at Vado Speedway Park. It's where passion, community, and high-speed thrills meet. Take a closer look at the hard work and dedication behind the exciting event. Got to interview Chris Kearns yesterday on the Vado Speedway Park live stream at noon, and we'll get to highlight that too. And in the Men's Health Minute, we'll discuss the importance of breaking cultural norms for better health in men. It's time to address and challenge the stereotypes that hinder proactive healthcare. As we journey through each of these segments, my aim is to connect, empower, and enlighten. Together, let's unravel the complex tapestry of healthcare, technology, and community wellness. Thank you to our incredible show sponsors, Pharmtrue, High Horse Cannabis Company, Vado Speedway Park, and the Baked Chicken Farm for their unwavering support in this endeavor. So tune in, engage, and be a part of this transformative experience. Let's learn, grow, and make positive changes together. Welcome to Know Your Pharmacist 2024, where every insight brings us to a closer, healthier, more informed world. So guys, $35 on insulin paying for Americans. How cool could this potentially be for us? Check it out. We're going to unpack this a little bit. So insulin price cap going into effect. More Americans right now eligible to purchase insulin for $35 after leading manufacturers instituted new pricing January 1st. So we are taking a good old look at this. Shout out to, our government on this one for finally starting to take a look at tackling those pricing and things like that. But, we still had to wait for a pretty long time. Anyways, trying to be announced starting last spring. Price cuts and price gaps were scheduled to be implemented as of yesterday. Eli Lilly is one of the first companies to announce its price cuts last year, calling on other companies to do the same. Danish company Novo Nordisk followed soon after cutting the prices of its 4 legacy products by 65 to 75%. Effective January 1st. In September, they launched the My Insulin RX program, which provides a 30-day supply of insulin for $35 to eligible patients. French drug maker Sanofi announced in March it would cap at $35 out-of-pocket costs for many patients getting its most prescribed insulin product. See, these three manufacturers control the vast majority of global insulin market. January 1st effective dates coincide with the provision of the 2021 American Rescue Plan Act that changes the amount of the rebate drug makers have to pay to Medicaid. So the new lower cost from the companies will save them money. Either way, we are getting absolutely price ballooned over here in America compared to what this stuff is paid anywhere else, right? So under the newly effective changes, the rebate is based on how much the drug's list price has increased compared with inflation, how deeply it's discounted in the commercial market. If the drug price rises higher than the rate of inflation, companies need to pay higher rebates. The rebate could end up being more expensive than the amount of money the drug makes, even from Medicaid. So drug makers, hopefully were incentivized, right, forced to some degree to comply with Medicaid and everything like that. But, guys, what we're looking at is, very, very happy that we've got basically some of our big three here, Sanofi, Novo Nordisk, and Eli Lilly getting those insulin costs down to $35, finally establishing, some sort of a standard. So very cool if you guys are on any of those medications that may be coming, insulin wide. There's a lot of different ones, but really could be looking at paying like a $35 cap. Depending on your insurance, depending on your eligibility, there's a lot of different types of insulin that these companies make. And so I really don't know the specifics. Still, I think very, very good to look at. All right, let's move on, guys. Tech Talk. So this is cool. Wanted to shout out this group, actually. The Harvard Computer Society started the Tech and Global Health Initiative. And what this is, a team of Harvard students passionate about global health innovation. Reading this here. Showing this, basically a team that got together from basically Harvard's, computer science program, and they started to identify a communication gap between healthcare sectors, technology, and healthcare, right? So literally, I think it's a very interesting scenario here because, they're looking to identify things like artificial intelligence helping to aid physicians in detecting early signs of cognitive or mental health disorders, right? Other things like smartwatches, right, which could actually help to have elderly patients maintain their independence, whatever scale that may be. So where you have, the computer geeks of Harvard actually starting to look into how to bust through those barriers of healthcare access and, quality of healthcare at combining the, resources and intelligence of technology, man, this is the kind of thing that is going to really move us along fast. Obviously universities and things like that give you, at least they were some of our biggest data processing institutions in the nation for, the last 100 years, minus probably select Fortune 500 companies or the bigger scales of data processing like that. But other than that, right, we are looking at institutional research that really started to, gather, drive, and compile lots of big data and lots of innovation as well. So, where you see college kids that have invented all kinds of cool stuff and helped, businesses and or communities to whatever degree with their inventions, innovations, and new different mindset. These are the kinds of ways, these are the kinds of people that really do help to spur new ideas. So even to our local guys, NMSU, UTEP, UNM, this is the kind of group that people really should be trying to figure out how to really make a difference, find a problem, connect it. Healthcare, technology, so doable, so exciting. 2024, pumped up to see what's going to happen. Only going to get better. So talking about 2024, dry January. Didn't quite realize dry January was a thing, but talk about dry January. Showing you guys here a little clip.
You may be taking a break from alcohol yourself. Many participants sign on to be healthier, to cut back on their drinking, or to simply start the year with a clear mind. Well, studies show the benefits of this challenge last well into the new year. For simply start the year.
Give me 2 seconds to reload that, I guess. That looks odd.
January this year, or you may be taking a break from alcohol yourself. Many participants sign on to be healthier, to cut back on their drinking, or to simply start the year with a clear mind. Well, studies show the benefits of this challenge last well into the new year. For more, I'm joined by Anahad O'Connor, a health columnist who wrote about this for the Washington Post. Welcome to you, Anahad. You know, I've been seeing this in my social media feed, all of the folks talking about taking part in Dry January. What are some of the health benefits of participating in this?
Yeah, so there have been studies on thousands of people who've participated in Dry January, and they've shown that people report everything from saving money by doing Dry January to having more energy. People report sleeping better. 6 out of 10 people report losing weight, having better concentration, having better skin. People are often surprised by the benefits that they see during Dry January.
That's quite a list. I mean, Dry January lasts only a month. How do these health benefits extend into the new year?
Yeah, so studies have also followed people 6 to 8 months after they've completed Dry January, and they find that more often than not, they continue drinking less, even if they resume their drinking. So they're drinking less frequently. On days when they do drink, they're consuming less alcohol. They report getting drunk less often. And one of the main reasons why is because people see these benefits. You know, they see what it's like to have better sleep, to lose weight, to have more energy, better concentration, and they want to continue that. So 6 to 8 months later, you see people continuing to consume less alcohol after doing Dry January or another sobriety challenge.
I mean, January is the time when we all try to make these kinds of resolutions, right? But how many people actually succeed at Dry January? Or is this the kind of thing like a gym membership where people, you know, tend to go hard at the beginning and then by about mid-January, February, they're like, okay, we're not going to continue this anymore?
So there are definitely people who fall into that bucket. But surveys have shown that about 3/4 of people who sign up for Dry January actually complete it successfully. But what's interesting is studies show that even people who do not go the whole month of January without having a drink still report these benefits and oftentimes still end up drinking less, after the month of January. So people still see these benefits, even if they're not completely dry during January.
You know, the data is so interesting. So for people who are listening to this and maybe thinking about this, what are some tips that you have to stay dry this month?
Yeah, so there's a lot of ways that you can boost your chances of success doing Dry January. One of the most important is to have social support. Studies show that people who do it with a friend or who download the Dry January app, which is free and it's called Try Dry, those people are actually more likely to succeed because when you're doing it, with a friend, you have that social support. When you're signing up for it and registering and you're downloading the app, you're getting, sort of coaching messages that are cheering you on. And you also get this experience that you're part of a larger thing. Another thing that can help is, finding a new favorite drink. A lot of people that I've spoken to who have, successfully completed Dry January and other sobriety challenges say that oftentimes, they drink at night just out of habit. But if you can replace that glass of wine that you're used to having in your hand at dinner with, a glass of sparkling water, or maybe some sparkling water with a dash of cranberry juice, that can get you out of the habit of just mindless drinking. And there's a lot of other things as well you can do.
All right, Anahad O'Connor, it's a lot of benefit I'm hearing. I have to ask, are you taking part in Dry January?
Yes, I have done it before, and I've seen these benefits. The most motivating one for me was the better sleep. I'm a dad with 2 little kids. I have a 4-year-old and a 1-year-old, and being able to keep up with them in the morning and not feeling sleep deprived or nursing a hangover is definitely worth going sober for a little while.
Yeah, as a parent, those early alarm clocks that we call children really can motivate you to try the Dry January thing. All right, Anahad O'Connor, a pleasure talking to you.
I'm up at 5 in the morning. So.
Thanks so much,
I appreciate it.
Anyways, so dry January is a thing. You can choose to do whatever you're going to do, right? Some people may have, some health related goals that dry January could support, right? And so for all those people who may consider it, especially because there's still plenty of time in January, definitely want to encourage healthy habits. This was, something I saw the other day I thought was very great. The idea of mocktails, right? So I linked you guys here 20 best healthy mocktails, non-alcoholic beverages, from the American Academy of Culinary Nutrition to thus, support anybody who wants to take part in that dry January, drink some mocktails instead of cocktails, have all the benefits of not only better skin, better health, from taking a month off, probably even a little bit of extra money in the wallet. Some could do it with cannabis too. A cannabis desensitization protocol really takes about 6 days to really get off of it, in terms of the full-on desensitization. Obviously, you can even have those longer benefits of getting it all the way out of your system. You're not going to be able to do mocktails and things like that, but another way, right, for people that, again, use that January so they don't think I'm just picking on alcohol by any means, right? You could use, for instance, cannabis in that situation as well. Probably not going to substitute mocktails in there, but maybe, right? Maybe you do the mocktails too. Whatever you want to do, I don't care. Have at it. But again, doesn't necessarily support my next segment, Herbal Wellness Corner, to talk cannabis in a dry January, because we're looking at a cool new study here from the Washington State University. Cannabis users less reliant on traditional sleep aids. So again, as I was mentioning a little bit earlier, guys, more than 80% of the 1,255 cannabis users surveyed for the Washington State University survey-led analysis reported no longer using over-the-counter or prescription sleep aids such as melatonin or benzos. Instead, they had a strong preference for inhaling high THC cannabis by smoking joints or vaporizing flower, two fast-acting methods that previous research has shown can help with difficulty falling asleep. Interestingly enough, around half the people in the study also specifically reported using cannabis strains containing CBD and the terpene myrcene, an aromatic plant compound found in hops, basil, and other plants in addition to cannabis. One of the findings surprised there was that people are seeking the terpene myrcene in cannabis to assist with sleep. Carrie Cutler, the senior author of the study and associate professor at psychology at WSU, there's some evidence in the scientific literature to support that myrcene may help promote sleep, so cannabis users seem to have figured that one out on their own. This one here I thought was awesome. Great study coming out of Washington State University. And on top of that, interestingly enough, they didn't put CBN in there. So I think, again, to my CBN is slightly kind of overhyped and this, that, and the other. Yes, I still support that. And I like that this study showing even myrcene from that terpene aid. But again, that actually probably has a lot more clinical benefit than CBN. But Cutter looking here suggesting, in general, the use of cannabis for sleep-related issues was perceived as more advantageous than over-the-counter medications or prescription sleep aids. Unlike long-acting sedatives and alcohol, dry January, cannabis was not associated with the hangover effect, although individuals reported some lingering effects such as sleepiness and changes in mood. The researchers also found that more than 60% of the study participants reported getting the recommended 6 to 8 hours of sleep when using cannabis alone. Less than 20% of the sample reported getting 6 to 8 hours of sleep while using prescription or over-the-counter sleep aid, or cannabis combined with the sleep aid. So additionally, only 33.8% reported using cannabis edibles to help them sleep, and 14.1% opted for THC capsules. So, those are longer lasting effects, right? But less commonly chosen. So perhaps here suggesting the need for quicker relief when falling asleep. Now, everybody's different in terms of dosing threshold, what you need, but, substitute those bad medications, right? Benzodiazepines, even melatonin can create that hangover effect. Cannabis doesn't put you in that situation, which is pretty nice. When dosed properly. Melatonin for some people can't shake it, some people doesn't work. But again, cannabis, when you're not hitting past your ceiling dose, you know that you're going to wake up in the morning refreshed. You're not going to be taking something that's going to cause you to sleepwalk, that's going to cause detrimental damage to your body. Very cool. Good study. All right, guys. Yesterday, got to talk to Chris Kearns, the director of the Wild West Shootout, the man, the myth, the legend. This was an awesome interview. But for those of you guys who don't know what the Wild West Shootout is, this is a giant multi-day, 6-day race over at Vado Speedway Park. You've got the best dirt track drivers coming in from all over the country, literally staying out there, racing, testing and tuning their cars, getting after it, having a blast. And guys, Kyle Larson, literally perhaps the greatest race car driver of all time, NASCAR champion, Bobby Pierce, Mike Marlar. There's some really, really big names, our local guys that I'm excited to go out there and watch compete. Obviously Jake Gallardo from our side, he's one of our huge, huge competitors. We've got the Scott brothers. They've got some very exciting racing that's going to be showcased as well. And everybody else, it's going to be a really fantastic time. But, me and Chris had a great conversation. For those of you who may be just curious, why is Joaquin posting all this stuff about the Wild West Shootout? What the heck is it? I highly recommend listening to this interview. Guys, fall in love with racing, dirt track racing, Vado Speedway Park. That's where it's at. Oh my gosh, it's going to be so fun. So we'll see you guys there. Last thing though, Men's Health Minute. I want to share this. Men chipped away at cultural norms that keep them from being healthier in 2023, but greater change is needed. So, Men's Health Minute, guys, we did it. We've been doing this since July. Pat yourself on the back, men. Did it in 2023. We recognized, that we are losing to ourselves. You could put it in, frame it into losing to our, female counterparts who are outliving us by about 7 years right now. But, we want to all live in harmony. We'd like to all, increase those lifespans and quality of life and lessen the burden on the system and so on and so forth. But, we got to first be able to take a better look at how to look at it. Rising obesity rates, diabetes, prediabetes, New Mexico. We took a good look at all of that here over the last since July. And I'm going to just keep hammering down on all that each and every single day, guys. We'll figure out everything we need to do to attack prediabetes, diabetes, blood pressure, cardiovascular risk, so on and so forth. And we'll chip away. 2023 showed us, hey, we found something here. Now we're going to figure this out. So that's all I got for you guys today. It's January 2nd. Hope you guys enjoy your new year.